I will talk about the importance of visual assessment and squint in children with Down syndrome. First of all, the Ministry of National Guard Health Affairs at Riyadh sought to provide a specialized hospital for children to be the nation's most advanced children's hospital, a unique addition to King Abdulaziz Medical City as a part of the new medical complex. This unique medical institute is named King Abdullah Specialized Children's Hospital. Operation Phase 1 was 2 weeks ago on April 19th, 2015. Down syndrome, keep calm, it's only an extra chromosome, or we can call it trisomy 21. You all know that they are hypotonic, hyperflexible, they have wide space between the eyes, mental retardation, and flattened facial features. I will talk about the ocular problems associated with Down syndrome. Children with Down syndrome have a higher prevalence of ocular disorder than age-matched, typically developing children. The common eye problems in Down syndrome children, they have a high prevalence in epicanthal folds, about 96.7%. They have poor accommodation, amblyopia, or we can call it lazy eye, squint or long-sighted, hyperopia, myopia, and astigmatism. Other eye conditions, nystagmus, cataract, keratoconus, nasolacrimal duct obstruction, blepharitis, infantile glaucoma, and brush field spots. First of all, refractive error. It's an error in focusing the light by the eye for frequent reason, which cause reduced visual acuity. It occurs when the eye cannot clearly focus the image from the outside world. It results in a blurred vision, which sometimes so severe that it causes visual impairment in children. Refractive error cannot be prevented, but it can be diagnosed by an eye examination with an optometrist or ophthalmologist and treated with corrective glasses. Refractive error can classify into three major: hyperopia, myopia, and astigmatism. First of all, hyperopia. It's happened when light rays focus in focal point behind the retina. It's difficult to see near object as it's appeared blurred. As you can see the image, on the left, normal vision, and hyperopia, it's on the right. In myopia, light rays focus in front of the retina, distant objects appear blurred. Astigmatism, light rays focus in two lines at right angle instead of one point. Blurred vision for both near and far objects caused by toric curvature of the front surface of the eye. The only treatment for refractive error for children is glasses. Convex lenses used to treat hyperopia, concave for myopia, and cylinder lenses for astigmatism. The second thing is strabismus, or we can call it cross eyes. It's a condition in which the eyes are not properly aligned with each other. There is four major forms in strabismus: esotropia, when the eye turned inward; exotropia, when the eye is turning out; hypertropia, when the eye is deviating up; and hypotropia, when the eye is deviated down. Treatment of strabismus can be in various ways, depending on the individual cause. It can be glasses in case of large uncorrected refractive error with prisms, eye patch in case of amblyopia, Botox injection, or surgery. It's more difficult to recognize squint in children with Down syndrome because of the distinctive appearance of the eyelid. Amblyopia, or as we call it, lazy eye, it's a condition in children when vision does not develop properly in one eye. If it's left untreated, a child's vision will never develop correctly in that eye. Vision impairment becomes permanent because as the child's brain matures, it will ignore the image coming from the poorly seeing eye. What causes amblyopia? Refractive error, strabismus, deprivation, with something block the light from getting through the eye, such as cataract or ptosis. How we can treat amblyopia? First, to treat the major cause, for example, cataract surgery for congenital cataract. The most common treatment for amblyopia is to force the brain to start using the bad eye by patching the good eye for several hours. This is a short video. I found it yesterday on the YouTube.
My name is Dr. Vicky, doctor for kids.
When Emma first came to my office, she had never worn glasses before, so she couldn't see any shapes, even if we held them right in front of her eyes. This is because she was born highly farsighted, which caused severe amblyopia, also known as lazy eye.
She used to be very close to the TV or computer. She used to close her eyes and start to focus. One of the eyes was crossing a lot.
The farsightedness not only made her vision blurry, but it also made her eyes cross, which caused constant double vision.
Especially kids with Down syndrome tend to suffer from the eyes, but we thought it was something minor. So when you told me that, I was I couldn't believe it.
If amblyopia isn't treated before age 6, it can lead to permanent vision loss. Poor vision can also prevent a child from learning, developing coordination, or even speaking. Once Emma started wearing her glasses, the vision in her right eye rapidly started improving to 20/20, but her left eye still crossed. Instead of an eye patch, I prescribed a special eye drop to encourage her to strengthen her lazy eye.
When she started using the glasses, we saw definitely a big change. She wasn't able to identify shapes, briefly some of the colors, and afterwards, it was like a miracle. She started talking all over, repeating. She started recognizing every of the shapes. Star, triangle, circle, square, and I was impressed because I've never seen her talking like that before. Look, now she never stopped.
In under a year, her vision improved to 20/20 in her glasses.
Look at that tiny one. Star, good job.
But it also developed depth perception, or
I told her we're going to the doctor. Eye doctor. She's like, doctor. You like to come to the doctor? Yes. You enjoy it? Yes. You like the test? I will definitely recommend any parents who think their child has an eye problem to bring them to Dr. Fisher as soon as possible because they're going to see a lot of improvement in their kids. You like coming to the doctor? Yes. In the doctor, I like it. I like it.
Now I will talk about Saudi children with Down syndrome. This is Layan, one of my patients. She's 2 years old. As you can notice, she have left ET, or we can call it left esotropia. Her left eye is turning in. It's non-accommodative esotropia. She's on the waiting list for surgery for squint. In King Abdulaziz Medical City in Riyadh, I collected data of 38 Saudi children with Down syndrome. Their age range between 1 to 14 years old. Data were collected during their visit to optometry clinic. Cyclorefraction results were collected to find the refractive error of 76 eyes. We found out that 46 were emmetropic. That means they don't have any refractive error. 25% had myopia. 28.95 had a hyperopia, and 60% had astigmatism. In this chart, you can see the percentage of the refractive error. You can see here that 46% were emmetrope, 25% were myope, and the majority, 29%, were hyperope. 61% were astigmatism. In strabismus, 9 children had strabismus. It's 23.6%. 7 of them had esotropia, and 2 of them had exotropia. 6 of the esotropic patients were hyperopic, and 1 was myopic. 1 of the exotropic patient was hyperope, and 1 was myope. So 25% percentage for strabismus, it's a little bit big. And this is percentage of strabismus. As you can see, esotropia came more with hyperopia, and esotropia, it's more common in Down syndrome. In the end, children with Down syndrome at a higher risk than typical children for refractive error and strabismus. Esotropia, hyperopia were more common. Failure of immobilization among Down children is believed to be the cause of high incidence of refractive error. A possible cause for higher incidence of strabismus in children was reduced accommodation. There is a natural time course for visual development. Need for glasses, reduced vision, a lazy eye, or squint can occur if visual development does not perfectly occur. Increased prevalence of visual impairment among those with learning disability, it's up to 28%. Children with Down syndrome are known to have slow growth that is consistent with the small eyes of hyperopia, so refractive error development may be determined in Down syndrome by non-optical factors. Early diagnosis and treatment of strabismus and associated ocular conditions such as refractive errors and amblyopia may improve the quality of life for children. Between 18 months and 2 years, all children with Down syndrome should have formal ocular visual assessment by an orthoptist and ophthalmologist or optometrist. This should be including orthoptic assessment for squint, refraction to find the refractive error, and fundus examination. Thank you.